The Medical College of Georgia at Augusta University, we're the largest trauma center in the area. We have a large catchment area that goes all the way from South Carolina through a large portion of Georgia. The trauma and the emergency general surgery patients go into our shock trauma ICU, which is a closed unit, and the surgical ICU also deals with all the other surgical patients that we have. The combination of those two things together allows us very good surgical critical care training in 1 year.
We have about a 16% penetrating trauma rate, so we see plenty of patients, plenty of complex patients. We're actually expanding the number of ICUs in the facility. So I think we're seeing increasing volume, and we're seeing putting more and more effort into the educational and the didactic side of things to improve the experience for the fellows.
So one of the things that was really important to me when I was choosing my fellowship was that I was going to get to operate. This fellowship, starting from the interview, you can see that that's the mentality of the program. They want you to operate. They want to train surgeons. It's not just about being an intensivist, it's about incorporating everything. All your training that you received during residency, and then putting that all together to be a true trauma surgeon. Fellow education is broken down into two different aspects. There's the one aspect where it's very collegial, very personal, where we sit down once a week and we go through our didactics and through surgical critical care literature and get to have real life clinical scenarios that are tied into the literature.
So I think the fellowship is really getting on an up and up. We're putting in place extra didactics, we're having multidisciplinary ICU conferences, we're making sure the fellows are embedded in all our clinical activities as well as our performance improvement activities. So we're having them take call, having them do operations as well, but we're also trying to make sure that they learn the skills that they'll need when they go out into practice. So this is a true fellowship program and not just added year of residency.
As the fellow, I actually lead ICU rounds every day. I have multiple learners, and we all work together in one big multidisciplinary team. It allows me to really mentor the learners and also to grow as an educator myself. We take call every other Saturday, and we really function as a junior attending on call. So from managing the patients in the trauma bay with the full resuscitation, to going to the operating room and walking the residents through the cases there, to managing the patients in the ICU, we really see the entire comprehensive care of a patient. It really helps bring everything together.
Living in Augusta is great. There's plenty of things to do, good restaurants, plenty of entertainers that come through with concerts. If you like outdoor stuff, there's hiking, there's biking, trails. We have lots of stuff to do. One of the good things is the cost of living is exceptional here. And all of that sort of in a package where you can enjoy the city, but at the same time, you don't have to fight traffic on your way home for an hour.
We care about our fellows, we really do. So what we're really trying to do is make sure that when our fellows finish, they're able to go off and work in private practice, academic, level 1, level 2, whatever kind of trauma center, and they have the necessary skills that they need.
There's no better place than the Medical College of Georgia at Augusta University to come and continue to be part of that tradition and put those finishing touches on your career.